Now, as I mentioned just a few moments ago, the case count of coronavirus has now risen to roughly 22.5 million cases in the United States. And the death toll is sadly also rising. Nearly 375,000 people have now lost their lives to the virus. And Arizona is a hotspot as the infection rate in the state has risen to over 13%. That's all according to Arizona's Department of Health. We're joined now by Dr. Shad Marvasti. He's the Director of Public Health Prevention and Health Promotion at the University of Arizona College of Medicine in Phoenix. He's also an Associate Professor of Family, Community, and Preventive Medicine. Dr. Shad, I'm wondering why Arizona is struggling so much right now with this virus.
Well, it's actually no surprise to me and to public health experts here in the state. If you look at the numbers, we haven't had any new mitigation measures since August. We've continued to see a rise for about 10 weeks now in all of the major metrics, including positivity rate, cases per 100,000. They first broke 10 and then over 100. We had the highest rate of growth in the whole country and actually on Earth in this last week. COVID-like illness is basically overwhelming our hospitals, routinely above 95% capacity, and care is really being compromised. So it's really a dangerous time here in Arizona. And all of it is expected because we haven't changed anything in terms of mitigation. We have no statewide enforced mask mandate, but all of it could have been prevented. And that's what's really tragic here.
You just mentioned some really incredible statistics there. You said worst in the world. What was it? The worst in the world in Arizona for what?
For the cases per 100,000 in terms of the rate of our growth per capita.
And are you squarely saying that this is a failure of the government officials in the state? Is that where you're squarely putting this blame?
Again, I'm nonpartisan. I'm not a politician, but absolutely. We've had an unprecedented call by modelers and experts from all three state universities, the CMOs of the major hospital health systems, all asking for major mitigation measures in accordance with the White House Coronavirus Task Force, which in late November, early December started calling for more mitigation in Arizona. All of this has fallen on deaf ears. We've asked for stopping high-risk indoor activities like dine-in restaurants, bars, nightclubs. We've even asked for the state to stop promoting tourism to the state. I gave some interviews back in November where we were actually promoting to people in California, other places where they have more strict guidelines in place to come and play in Arizona. And what that's resulted in is that we've not become just a playground for others, but really a breeding ground for COVID-19.
So the top COVID-19 tester in the state, I mean, just to pile on with the bad news, saying that they might have to shut down now because of a lack of funding. So we've heard folks talk about, obviously, we need more testing, we need more testing, we need more testing in order to make sure that folks that have the virus, even if they're asymptomatic, stay home. And the only way to know that is to go out, get tested, and figure out if you have the virus or not. So how does this reduction of testing or this potential reduction in testing, how does that play into what we are seeing in Arizona right now?
Well, it only makes things worse because we've never really actually achieved the optimal amount of testing. We never actually effectively contact traced or anything because we never got it under control here. We only had a reduction to a plateau. And so without adequate testing, you can't identify the cases that are out there. You can't have people isolate. We've had breakthrough technologies in terms of even at-home testing, rapid testing, yet these aren't being distributed. And there's CARES funds that are available that have been distributed to our state, but they've been used to balance the state budget, whereas instead, we could have used them to even pay people to stay home and also expand testing. I think one of the issues here, obviously, you guys are talking about business. People think it's a false, they make a false dichotomy here. They think it's saving lives versus saving the economy. And we've really been, our state leadership has been very sensitive to the needs of businesses. But the reality is that we could have used these funds to pay people to stay home, to pay small businesses, and to expand testing in order to protect public health. And the choices we've made have clearly been a failure.
What's it like on the ground right now? We're hearing all of these numbers, but you're obviously working on the ground. What's it like on the ground, and when do you think we might be able to get over this hump through this really dark period. Everyone's been saying it's going to be a very dark winter. When do you think we're going to be on the other side of that?
Well, we're not going to be on the other side of that until we get the majority of folks vaccinated, or we actually start doing what's worked in Taiwan and Australia and New Zealand. They didn't have a secret vaccine. They just used masks and public health guidelines that we haven't done. We changed our benchmarks here so that we could just stay open indefinitely, no matter what, without any evidence to support that. What we're seeing on the ground now is that the ratio of staffing for nurses has gone up. Usually 1 to 2, 1 to 1 in the ICUs, like 2 or 3 on the floor. It's now 4 or 5. People are being sent home with home oxygen, but the home oxygen companies aren't actually able to produce enough oxygen to send people home with oxygen. Your care is actually being limited now. People are being discharged when they don't. They really need to be staying in the hospital. The morale is low. Healthcare workers are really exhausted and frustrated when we see basically people just acting as if life is normal outside. And then we're not seeing the response from our state leadership to actually do everything we can to save lives. And it really is a tragic situation. The best way to get past this, again, we know is it's not a mystery. It's masks, it's distancing, it's closing high-risk businesses, paying them to close to save the economy as well for a short period of time, expanding testing, and then really being efficient and effective with vaccinations. And my hope is with the new administration that we get a national mask mandate, a national testing strategy, and a national approach to mitigation measures so that we can really get this pandemic under control.
Some really concerning information there, but necessary. The truth is absolutely necessary as we all do our part to fight this pandemic. Dr. Shad Marvasti, University of Arizona College of Medicine in Phoenix, thank you so much for joining us today.
Thank you.